This is a systematic step-by-step method for checking everything in a chest x-ray for abnormalities or to ensure that a chest x-ray is normal. A is for airways, looking at the trachea for example. B is for breathing, looking at the lungs and the pleural space itself. C is for circulation, so looking at the heart and vessels. D is for the diaphragm. And E is for everything else, which includes bones. So, for example, the shoulder girdle and the clavicles, looking at the soft tissues. And F is for foreign bodies. What is included in circulation? Circulation is mainly focusing on the heart and the mediastinal contours. So we have the heart, the left and right hilum, the trachea, which we've mentioned in previous videos, the aortic knuckle on the left-hand side, the descending aorta, the right paratracheal stripe, and the azygous vein, both on the right hand side. Now let's look at the heart. When it comes to circulation, what things are we looking for? We need to check that the aortic knuckle and the descending aorta are in the correct position. We have to look at the heart and the width of the heart in relation to the chest. The cardiothoracic ratio is a measurement used to check that the heart is less than 50% of the chest width. And if the width of the heart is more than 50% of the chest width, this could indicate that there is a pathology. Looking at the other mediastinal structures, is the left hilum higher than the right hilum? If it isn't, this could indicate there is a pathology. And is the right paratracheal stripe and the azygous vein the right appearance? Do they look enlarged? Let's take a look at some abnormal examples. Do you notice anything strange with this x-ray? This is an abnormal chest x-ray. As we can see, the heart should be on the left side. However, in this picture, it's on the right. This is called dextrocardia, and this is normal for some patients, as it's a congenital condition. However, this is not typical for a normal chest. Usually, it should be on the left. Take a look at this example. Do you notice anything strange? How does the heart width look in relation to the rest of the chest? This example is when the width of the heart is greater than 50% of the chest width. As we can see, the width of this heart is greater than 50% of the chest width, and this is abnormal. This is a demonstration of cardiomegaly, which usually occurs as a result of high blood pressure, as the heart is working extra hard to pump blood around the body. This is usually due to an underlying condition. This is a serious chronic condition. Now for our last example. What appearances do you see here? As you can see, this bulge, which can be seen on the left and right side, is the dilated aorta, and this is called ascending aortic aneurysm, which is caused by a number of different things such as age, smoking, could also be caused by trauma. How can we use circulation to see if an x-ray is normal? Let's take a look. This is a normal chest x-ray, and we can see that circulation in this chest x-ray is normal because the aortic knuckle and the descending aorta look normal. The cardiothoracic ratio is less than 50%. The left hilum is slightly higher than the right, and both appear normal. The right paratracheal stripe and the azygous vein appear normal too, and the sizes are what we would expect them to be. So by assessing circulation, we know that the circulation elements in this chest are all normal. And by using the rest of the ABCDEF methods, we would be able to check the whole x-ray to ensure that everything is normal, or to decide if things are abnormal in your OSCE exams. Common mistakes students make when assessing circulation in a chest x-ray include not taking your time and slowing down to look at every structure. Remember, you must look at all structures in the upper mediastinum and the heart, making sure that all the sizes are as you would expect and there are no abnormal appearances. Check all around the heart and make sure the structures adjacent to it all appear normal. You don't want to lose critical marks or make a wrong diagnosis. In our next video, we will be looking at D, which is diaphragms. Make sure you don't miss that next video. If you missed our previous video on breathing, you can click the link here. Do you have an OSCE exam coming up? Make sure you subscribe so you don't miss these weekly x-ray tips.